So I'm a board certified psychiatrist, and it's my job to help PMHNPs gain clinical confidence so that way they can treat patients better, they can get over imposter syndrome, and really master psychiatry. And I've helped over 160 PMHNPs in our coaching program to do exactly this. And so today I'm going to be covering Concerta or methylphenidate. This is a very common medication that every PMHNP should know and understand because you will see it a lot and you will use it a lot in clinical practice. So for Concerta, what we have to understand is that it is fundamentally, it's a long-acting methylphenidate. That's the biggest thing about it. So it's 10 to 12 hours. So the different methylphenidates, like there's Ritalin and there's Focalin, things like that. And so with this one, this is the longest acting of them. So it's 10 to 12 hours long. Like that's the long duration is. And the main use that it has is for ADHD. So it's a stimulant and it's mainly meant for ADHD, but it can also help with increasing energy. So like, for example, for fatigue, decreasing appetite. So for appetite suppression, binge eating, it's not FDA approved for that, but it still can be used. But by and large for ADHD and some like treatment resistant depression augmentation. So that there is some use for that as well. But by and large, ADHD. And so what makes Concerta unique amongst the other stimulants is its mechanism of action. So it uses this thing called the OROS. So basically what that is the osmotic, so OROS, so osmotic release delivery system. And basically all this means is that, so here we have the water and here we have the medication. So imagine this is like a pill. And so what happens is that water starts coming in. So H2O will go in, right? So as you swallow it, the body, you get water going in. And then this water will push up here. And then in turn, this will push out the medication. So you'll end up having a system throughout the day where now you see how the water has gotten bigger and the medication is getting pushed out. So that's literally all it means, is that that's how it gives it the slow release, is that the water comes in, it fills up the capsule, and then in turn slowly releases the drug into the system. So that's how you get that sustained release for 12 hours. But what we got to understand is that this system is patented. And so that's why brand name Concerta is different than generic. So it's different because the generic systems are not able to use this oral of their own mechanisms. So that's why you might hear a patient say that, oh, the brand works better for me. And it's probably due to the OROS system, like the patented version of that. And so the way that it works, the mechanism of action, is it helps increase norepinephrine and increases dopamine by decreasing reuptake. So basically in the synapse, it'll stop the reuptake of that. And so when you stop the reuptake of this medication, then the norepinephrine and the dopamine get released. That's the whole mechanism behind it. And for dosing, so this dosing is a little bit unique. It starts at 18 milligrams and goes up to 72. So it comes in these weird variables. So like it comes in a 27, a 36. It doesn't come in a 45 actually, but it comes in a 54, 63. So basically that's the way that it dosed. You go up these intervals. But the FDA max is typically 72 milligrams. However, you can go higher than that if you need to. So 81, 90, etc. Especially if you have a patient who is severely treatment resistant or they have a high tolerance. For example, I have a autism patient, and so he also has developmental delay, so he needs higher dose like 90 milligrams. The 72 is not enough for him. But this gives you a lot of flexibility in how to dose. And a stimulant, you can increase pretty quickly because you'll get a benefit pretty quickly, which is different than an SSRI, which you have to give it a lot of time to really build up into the system. So luckily, the cost is pretty cheap, maybe around $40 for the generic. You want to do this in the AM. Just once a day in the AM, you want to give Concerta because if they stay up too late or if they take it too late, it can cause insomnia. So we want to make sure that we avoid that. So for example, I had a patient tell me that she was taking her long-acting stimulant at 3 p.m. And I was like, and she was saying she has trouble sleeping. So that's why I was like, no. You need to take this very early, like take it first thing in the morning, so that way you notice the benefit last throughout the day. Sometimes what you can do, so you can plus minus IR dose. So it's supposed to last about 10 to 12 hours. Some patients may say that they notice it diminishing maybe around 3 to 4 p.m.-ish, but they still might be working later. For example, I have a lawyer client, and so for her, she needs a booster in the afternoon to really help get through those late afternoon hours. Side effects are insomnia, decreased appetite, increased heart rate, some nausea. Those are the most common side effects. Increased BP as well. But yeah, those are the most common side effects. Irritability as well, that can happen. Less likely with Concerta because it's such a well-controlled release throughout the day that it tends to be more stable. The IRs usually can cause more of the irritability, but it certainly is still a very valid concern with this. So main things, contraindications that you want to be aware of are just any kind of heart issues. So heart problems, be cautious. Just because you don't want to exacerbate things too much, but if it's mild stuff, then you can certainly use a stimulant and you can certainly use Concerta. I would recommend a long-acting one if there's a cardiac patient because it's more stable rather than an IR one, which is a lot more up and down. Yeah, I mean, that's the main things you really have to know about Concerta. So long-acting, that's the main thing. The OROS system, ADHD use, norepinephrine, dopamine, 18 to 72, that's the standard dosage range. May need an IR version, and then some of the standard side effects with all the other stimulants. So overall, I like to use this medication a lot. So typically, if I want a long-acting medication, if I'm leaning on the methylphenidate side, because the equivalent would be Vyvanse in the amphetamine side, Concerta is a definite go-to, and I find patients get a lot of good results from it. So if you want to learn more, psychiatry, especially for me, you want to be able to ask me about your clinical cases, ask me clinical questions, and really become a master at diagnosing, at treatment, so that way you can give your patients the best results. I would look at joining our NP Coaching Academy. So we have over 160 PMHNPs who've joined as of this recording, and more join every day. So definitely join now so that way you can lock in your spot and also lock in your price before it gets more expensive. I hope this has been helpful, and I will see you in the next video.